Thank you very much, Junko-san. And good afternoon, everyone. It's always great to be back at APACC and in Tokyo. And APACC has asked me to speak on sustainability from an academic perspective. But before I do that, I think there's not many people in this room who've probably tracked the HIV career similar to mine. Maybe Justin, I'm looking at you, or maybe not. Kevin, certainly. This iconic photograph from Life magazine from 1990 would be something that Kevin and I, and I think not many of you in the room may remember. But given where we are in the HIV epidemic, I thought I would share this photograph with you to remind us, and this is when I get terribly emotional, of how far we have come. You know, when I was training to be an HIV physician at Fairfield, scenes like this was an everyday thing in the wards. We would go and see patients, and, you know, beyond thoughts and prayers, there was not a lot that we could do in those days, in the 1990s, in the early 1990s. I returned to Malaysia to have many of these scenes replay again because countries in our region, unlike Australia where I train, only was able to access antiretroviral, or as it was called at the time, combination antiretroviral therapy, or HART, somewhere in the late 2000s. But in the last 10 to 20 years, through domestic spending, through Global Fund and many other efforts, many of course, in the region also led by our host country here, Japan, we have seen a remarkable turnaround in what was literally a death sentence. And we know how many lives have been averted by the miracles of the antiretroviral therapy and the scale-up of that response. But we also know that initially that response was very patchy. And if you can see from this old publication from AIDS in 2012, how the steep decline in North America was mirrored on the opposite side by, in many countries in sub-Saharan Africa and Caribbean, in Asia, by actually a steep incline. And that was the disparity that the world was facing until the early 2000s because of the lack of access to treatment. So I share Eamon's thoughts in terms of sustainability, what it means. It's, of course, financial sustainability is the most important thing. Without the dollars and cents to afford this treatment, whether it's antiretroviral therapy for treatment, antiretroviral therapy for prevention, we need the money. But beyond that, we also need improvements in system integration, in legal and social environments, and of course, in community engagement and leaderships. I won't belabor the financial sustainability, except to say that many publications are coming through in terms of what the impact of the sudden withdrawal of US funding is going to have on the world, on lives, particularly in sub-Saharan Africa, and I'm sure many of you have seen this from colleagues, led by colleagues from the Burnett, actually, in Melbourne, data from 26 countries, and it's expected that an additional 4.43 to 10.75 million new infections, including close to 1 million children, could occur by 2030, and between 750,000 to 3 million more people could die from HIV-related causes. What about system integration? I think, once again, Japan is leading in terms of the advocacy for UHC. But I'd also like to share that in Malaysia, we've also, with the leadership of the Ministry of Health, been doing our way of integrating community-based services with Ministry of Health-led services in co-locating services to key populations with that of district clinics all over Malaysia. And I think this has been quite a successful model in terms of optimizing resources, but also in reaching out to key populations who may not otherwise want to go to standard Ministry of Health clinics for fear of stigma and discrimination. But what I want to also say is that, there's systems integration and there's systems integration, the what's, the how, to do it requires a lot more evaluation and to see what works and what doesn't. Here's an example of a systematic review and meta-analysis from the UNAIDS expert group on integration and others that looks at different models that work and also models that don't work. Now, the third thing that Eamon has also touched on, and something that I found myself being very much involved with, given that one area that I've been deeply involved with is treatment and prevention of people who use drugs. And this is, if we're talking about sustainability, then addressing the legal and social environment that key populations find themselves in terms of coming forward for prevention as well as treatment is one area that requires much attention. As you can see, legal barriers to the HIV response remain in 39 of the UN member states in Asia Pacific for nearly all of the key populations we work with. And we know there have been research looking at the impact of criminalization and HIV. This is just one example where in countries where criminalization occur for same-sex, the knowledge of the HIV status and subsequent viral suppression is less compared to countries that do not criminalize same-sex, and likewise for sex work and drug use. And in short, criminalizing of all three of these areas was associated with approximately 18 to 24% worse outcomes. And finally, in terms of another key pillar of sustainability, as you all know, and this is something that I think we in the HIV world can bring to the greater global health world in terms of what we do best, community engagement and leadership, involving communities in not just co-designing programs, but community-based monitoring, peer-led interventions. Thailand has great examples of key population-led clinics and antiretroviral treatment, and of course, the role we play as advocates. And once again, the financial crisis that we're all facing not only has a huge impact on delivery of on purchase of antiretroviral therapy, but of course, one of the first that's going to be affected are the community organizations who, in the first place, before this crisis, have been underfunded and, dare I say, undervalued in almost all national strategies. So with that, what role does academia play? First and foremost, I think all of you don't need reminder that as researchers and scientists, science plays a huge role. Sadly, it's not just funding of programs, but science itself and research itself is currently under assault in the US. But we must stand firm in terms of the importance of science. Otherwise, how else are we going to get these breakthroughs like the twice-yearly lenacapavir for HIV treatment that was announced last year at the AIDS conference? How else are we going to get this even more exciting breakthrough from one of our scientific committee members, Sharon Lewin, who unfortunately can't be here, in terms of this groundbreaking work that appeared in Nature Communications just last week, I think, and was picked up by the New York Times, in the use of mRNA to kind of wake up the resting T cells in that very important phase of HIV latency. And so as researchers and as academics, we must continue to advocate and you know, something that often we're not very good at in terms of selling ourselves and why science is important, why research is important, and why we need the funding to do this important work. The second, in terms of why science is important, and I think once we've discovered, you know, for example, the you know, U equals U, or any such breakthrough understanding of the importance of antiretroviral therapy for treatment or prevention, we then need to scale it up. And the best way is, of course, through implementation research. And here's just one example of possibly one of the largest HIV implementation research, the HPTN 071 POP-ART study, involving over 1 million recipients and 21 communities. So, and this is how, you know, science then tells us what works and what doesn't work at a large scale. And through POP-ART, for example, this test and treat, test and immediately treat leads to 30% reduction in new HIV infections and achieve a remarkable degree of testing coverage, even in remote parts of Africa, and increase viral suppression. And then, of course, our role as academics and researchers, one of the most important roles, I think, in which we tried to do that with the leadership of Junko Tanuma. We had the opportunity to meet with His Excellency, the Foreign Minister, this morning, and as well as Ambassador Nakamura, in the important role we as researchers and scientists play as advocates, not just to advocate to political leaders in terms of today. The message was, of course, to acknowledge the important role that Japan plays in global health leadership and global health funding, but also our role in advocating with pharmaceuticals in you know, making all these new advances accessible to countries that need it most. I was just discussing with a few colleagues yesterday how this is something that we in the HIV world do particularly well. If you think about our colleagues in oncology, you know, the price of HPV vaccine, which has been around for a long, long time, is still extremely high and inaccessible to many parts of the world. So this is another important role that we as academics and scientists and researchers play as advocates to ensure sustainability of the HIV response, particularly in this day and age where financial resource is limited. So with that, I just want to end up with, you know, on where we go from here. So governments, we've heard the importance of domestic funding, and I'm proud to say that Malaysia has done as much as we can in terms of for our level of economic development in self-funding. We still rely a little bit on the Global Fund, but by and large, for both treatment and prevention, we're transitioning to domestic funding. I've already stressed the role that we as academics play, but also the important role that we play in terms of working together. And I think here probably the best example, it's not so much in the HIV response, but if we remember in the COVID response, it was only by all of us working together that we finally saw the end of COVID as a major public, as a pandemic. And again, we in HIV, I think, probably can also be proud of how we work hand in hand with civil society much more than other diseases. And then finally, the importance of international partners. And as you know, it's not just about relying, the lesson learned from the last few months is not just relying on one country, but the global world must come together. And I think here in the Asia Pacific, where we have 3/4 of the world population, it's now an important time that countries, particularly in the upper middle income bracket, come together to support countries around us, perhaps not just in dollars and cents, but also in knowledge transfer, in capacity building, in technical assistance that we could provide to one another in this crucial moment where essentially we have all the tools to end AIDS. It's just how do we reach them to people who need them most. So thank you very much.